The challenges of living with disorders and diseases of the blood have been shared by patients, carers and clinicians at a conference staged by the North East Haematology Nurses Group, who cover an area stretching from Hexham to Northallerton.
Today's event is about bringing people together who have suffered from haematological illnesses. Some of them are cancer, some of them are not, and it's about them learning about new therapies that are available and treatment for the future, and about living with and beyond cancer and how to become a survivor of cancer, really, because people survive a lot longer now with new treatments and things, and it's a life-changing event.
We initially did it because we felt after patients finished treatment, there's not a lot, or there wasn't a lot out there 8 years ago. So we, as a group of nurses, we thought this was one way to get everyone together so they can share experiences and they feel that they're not the only ones going through what they've been through.
The keynote speaker was Professor Graham Jackson, a professor of clinical haematology at Newcastle University and the Freeman Hospital.
We're very lucky in this region. We have some of the best nursing teams, and I'm really proud to be here because I want to help our nurses who've organised this wonderful conference. They are very patient focused, they want to educate the patients, and it's an honour to be here and to support a wonderful team of nurses right across the North East.
Among the other speakers was Peter Green. He's been living with his particular form of cancer for over 7 years.
It's quite an isolating disease. I think a lot of people get diagnosed and are put on this programme called Watch and Wait, which means we've diagnosed that you've got leukemia, but we don't need to do any treatment at this stage. And I think people get anxious, confused, and I think it's useful to get together and kind of share your own experiences in terms of what's happened to you, because I think listening to somebody who's actually gone through the same process as you've gone but has then had treatment and is at the other side of it is kind of really useful, because I think it gives people a bit of reassurance and a bit of confidence and hopefully a bit of optimism.
There was also a number of exhibition stands, including one from the charity Look Good, Feel Better, who provides support for women and teenagers suffering from the visible side effects of cancer treatment. Pamela Page from the charity has battled multiple myeloma.
I've been in the cosmetic industry for many, many years, and I can honestly say, hand on heart, after every workshop I used to say, thank you God for my good health. And one day it was me with my diagnosis. But because of my diagnosis now, I find this a wonderful empathy between me and the patients. They know that I know what they're going through, and this really helps them. And I hope that I can give them good advice, help, encouragement along the way. And that takes a little bit of the fear out of it when they see somebody who's come through successfully.
Patients, their families and carers had the opportunities to hear about the very latest treatments for their particular conditions.
I work for County Durham and Darlington NHS Trust. We provide a clinical haematology service across Durham, Darlington and Bishop Auckland. Lymphoma is the commonest haematology cancer that we do see, and this is a session that I've been doing here today. Lymphomas are a hugely varied set of diseases that present different challenges in terms of management and also treatments, and they behave very differently, so one lymphoma is not like another.
There were two special guests, former footballer and now coach Kevin Ball, and Angela Baker, who became known as the original Calendar Girl following the death of her husband.
2 hours before we were having our photographs taken, undo your bra straps, girls, so you don't have a mark, and that's all we did.
I think I'm a bit of the light relief at the end of a very heavy day, but I'm here because my husband died of non-Hodgkin's lymphoma. We raise our money for Bloodwise, and you know, I think it's important to be at these kind of events.
Kevin, I'm sorry, he said we haven't got enough money to sign you on as a young professional. He said we're going to have to release you. And I remember thinking, why didn't you just tell me I'm not good enough? Why didn't you just tell me what I need to work at? Why don't you tell me where I'm short? Because that'll give me something to go away with, to be able to get better at.
We get challenges in our life, and the biggest thing we need to do when we get a challenge is find ways of overcoming them. But also to make them understand that my life's never gone right. You know, there's been issues in my life, challenges in my life, and when they see that, I think they then realise that it happens to us all. And you hopefully that helps build up that little bit of resilience in them, so if the challenge comes again, they can face it. They have a lot of love.